exposed very, very much to Marxism formally, but I learned a lot from the graduate students. They were much more open than the faculty there. But was a place where I learned not only about statistical modeling, but also about social theory and to some degree biological theory that is related to ecosystem thinking rather than to separating the effects of alienated factors that are considered to be independent of the system that they belong to. And I feel that that my history in this department has been one of struggle with that kind of orientation.
Well, you're almost a program area of your own in the department, and have been for decades, in doing community-based participatory research, for example, on working on environmental justice, on having a socially critical perspective that understands the causation of disease in relation to social processes and structures. Am I missing the fact? Am I forgetting about faculty?
I don't know that I'm a program area, but
well,
that sounds very official.
I didn't mean it in the official sense, but
that's something that's interested me for a long time. Although I didn't come here with any experience in that area, I learned about it while I was on faculty.
So you joined the faculty. Well, so let me catch up. So you got your PhD in 83, and then did you join the faculty right away?
No, I had 2 years as a postdoc.
Okay, and that was with
Altair Roller.
With Altair Roller.
And then
what were you working on? Specifically, was there a particular area that you're working with him on? Was it still the?
I worked on some follow-up to the research I had started in my dissertation.
Was it that year of the cardiovascular disease decline? Was it happening evenly?
Yes, and so then I actually maybe I initiated a series of studies that in a way were about decomposition of the decline of coronary heart disease mortality in the United States. So the epidemic curve began at some unknown point prior to the availability of adequate data, but early 20th century.
Mm-hmm.
And then reached a peak nationally in 1968,
mm-hmm.
and then was followed by a decline.
Mm-hmm.
And so the idea that I had around that time and pursued along with others in our department was that there would be spatial variation in that trend.
Mm-hmm.
Some places would have experienced the peak earlier, and some places late, and some subpopulations earlier and
mm-hmm.
later. And that if we knew something about that epidemic curve and the differences between different places and people, that they would help us potentially understand something about why coronary heart disease had declined.
Mm-hmm.
And at that time, I became interested in the debates about who would claim credit.
Mm-hmm.
You remember that?
I do, yeah.
In 1978, the National Heart, Lung, and Blood Institute held a conference, which resulted in at the time, I think, fairly well-known report
mm-hmm.
about the epidemic, the decline,
mm-hmm.
recent decline of coronary heart disease. And there was an approach to studying that, in which scholars from different academic disciplines were fighting over who could find the best evidence to claim that they were responsible.
Right. Prevention via blood pressure control or
Right.
emergency medical
So
services.
the options here
Mhm.
would be that it's the emergency room physicians who were saving people who came in with heart attacks,
Mhm.
or it was people who tried to enforce smoking bans,
Mhm.
or to get more of the population on lifelong drugs
Mhm.
for hypertension and hypercholesterolemia and so on. And so I guess partly I felt like it was very self-serving. Everybody was saying, it's me, I'm the one who gets to take credit. And at the time I remember thinking, well, nobody's trying to take credit for the increases in cancer mortality that are occurring during the same time.
You are a critical son of a... never mind.
So the work we did in the 80s on variation in the timing of the onset of the decline of coronary heart disease mortality was related to that setting. It was the setting in which there were these debates. And, one of the things actually that we're taught in epidemiology that I think is one of the great strengths of our discipline is not to accept that if I do something whether it's to a patient or to change a policy, that if the patient gets better, it's not necessarily because I did something.
Mm-hmm.
So just because Jon Snow rips off the pump handle doesn't mean that that's why the cholera epidemic waned.
Mm-hmm.
And we have to be more analytical about this.
Mm-hmm.
So my interest was in more general cultural and social changes that could have been behind the epidemic of coronary heart disease. And at the time, I became particularly interested in the related topic of the trend in mortality from stroke and the role of antihypertensive medication. So one of the things I did as a postdoc that I had the most fun with was, at the time in the late 70s, there was a book which was very disturbing to a lot of people in medicine. And it was a book by Thomas McCune called The Role of Medicine. And it was based on a series of articles. McCune was a medical demographer, and he had already published a series of very careful analyses in which he showed that most of the declines of infectious diseases, mortality from infectious diseases, occurred before there was any effective treatment or vaccination.
Mm-hmm.
And his theories had to do with the role of better nutrition and better housing and better sanitation.
Mm-hmm.
And I was interested in extending those kinds of arguments into the topic of the cardiovascular diseases and really non-infectious diseases. So I worked at some length on a paper which I titled Imitating McCune, the Role of Medicine in the Decline of Hypertension-Related Mortality. And so the empirical work we were doing with vital statistics, which I felt prepared for by my demography training, was taking place within that substantive area of interest.
Mm-hmm. And your studies, at least one of your papers on the decline in cardiovascular disease, was based on county level data, wasn't it?
Well,
Or an analysis of counties? What was it?
Right. I think most of the analyses were actually based on county groups
Mm-hmm.
in order to have enough events.
Mm-hmm.
There are so many counties, maybe more than 3,500 in the country,
Mm-hmm.
that a large number of them would have so few events that we wouldn't be able to characterize their mortality trends very well.
But it was
But these
Aggregate-
were county
aggregates.
groups that at the time the Census Bureau referred to as state economic areas.
uh-huh.
So that was one of the spatial levels of aggregation that we used.
Because there are not many studies in our department that have been carried out in that way. Is that not correct?
I haven't done any kind of survey to.
Of course,
To answer that question.
I make up these observations. I can't think of. It's called the availability heuristic. If you can't think of it, it's probably not very. Okay, I won't embarrass myself more yet. One of the things on my list is to hear about Epi 160. And I know you were one of the people who was privileged enough to teach Epi 160.
I was.
Could you
And
tell?
I do consider it a privilege, even though I believe it was part of a system of exploitation
Mhm.
in our department.
Mm-hmm.
And by that, I mean that people who were not eligible for tenure
Mm-hmm.
were assigned what, in some ways, is the most burdensome teaching responsibility involving the most students who have the least interest in the field.
Mm-hmm.
Nonetheless, I took it seriously, and I enjoyed trying to communicate with people who were not studying epidemiology. And I always remember that I asked at the beginning of one semester for a show of hands in the auditorium,
Mm-hmm.
which, probably had somewhere between 150 and 180 people in it. I asked for a show of hands. How many of you are here because it's required?
Mm-hmm.
And basically everybody raised their hands.
Mm-hmm.
So there was a lot of people who would be reading the Daily Tar Heel in class, or
Yeah, this was the pre-computer era. What
Yeah.
could they do? No cell phones.
Right.
So what year, do you remember what year that was? Roughly years?
I was involved in that class every semester, so fall and spring, between about 1987 and maybe 1990 or 91.
Mm-hmm. And you were teaching with Tim
Something like
Wilkowski,
that.
is that right?
Tim Wilkowski was involved, Meg McCann was involved. And I guess those were my co-instructors.
Well, I've jumped ahead a little bit and skipped your getting on the faculty, but let's talk about Epi 160, but then we'll backtrack and get you onto the faculty. As I recall, there was at least 1 year then when you didn't have any teaching assistants.
I remember having
budget problem?
teaching assistants every year. But of course, this was back in the days when teaching assistants weren't necessarily paid.
Well, yeah, maybe that's what it was. But
And of course, there was a student uprising subsequently,
I remember.
which led to a new system in which teaching assistants were rightly paid for their services.
Well, I remember. I mean, I was a teaching assistant for free. You must have been too.
I must have been too. Although at the time, I was on a training grant,
Ah, okay.
and I considered
Oh, well, that's an
my
interesting
teaching
point. Interesting
to
point.
be. I was getting a monthly stipend,
Mhm.
so I didn't consider it personally at the time to be a matter of exploitation.
You know, I have to admit, I never made that connection. I was on a training grant too, and I never made that connection. I wonder if the uprising that you refer to was in some way timed with the greater proportion of our students who were not on training grants.
Could be. That's a good point. I hadn't thought about that.
I hadn't either until you mentioned it. But there was something that went on, I thought, maybe it was a different year, because there was some interval around there when Maybe it was after that, because when they were starting, maybe after they started paying teaching assistants, and then there was a year when the money wasn't available and they didn't have teaching
That may have been
assistants.
after I taught that class.
Perhaps it was. So let's get you back onto the let's get you onto the faculty. So you had your postdoc. After 1983, you had the postdoc, a 2-year postdoc with
Right.
Al Taroller.
And then in 1985, I received a 1 or maybe it was 2-year contract as a research assistant professor.
Mm-hmm.
And my salary was supported in large part by a contract
Mm-hmm.
from the United States EPA.
Oh, EPA.
Yes.
Uh-huh.
Which at the
That's with
time-
Carl Shai. Were you?
No. It was actually related to cardiovascular disease.
Oh. Is it a contract that you got?
No, I think it was a contract that was arranged by maybe Tyroller and Heiss, something like that.
Mm-hmm.
I don't remember the details.
Mm-hmm.
But I do know that we were working still on vital statistics analyses, and there were also analyses that were being done of NHANES data having to do with lead and blood pressure.
Mm-hmm.
Because EPA at the time was interested in the role of the banning of leaded gasoline in changing lead levels in the U.S. population, blood lead levels. But kind of fortuitously again, and following the money as always, the EPA contract ended very abruptly
Huh.
in 1987, 2 years after I had started. And I was faced with either losing my job, because I had these 1 year, or maybe once or twice it was a 2-year contract, or finding other work, paid work.
Mm-hmm.
And that was the year that Harvey Checkaway left our department to go to the University of Washington in Seattle. And his work still had to be done. He was leaving the research projects that he had been responsible for.
Mm-hmm.
And so I took over.
Just like
the
when you were
work.
at Duke. at
Just like,
demography.
yeah, I go where the money is.
Well, and
So-
somebody left and Steve,
Somebody
please,
left.
we need you.
Somebody left, so I was there to step in, and I needed
Yeah.
a job.
Yeah, well, a lot of
So
us do.
at the time,
Until we retire.
right? So at the time, I took on 2 projects that
Mhm.
Harvey had been involved in. One was a study of workers in the dusty trades, so-called, in North Carolina. So these are workers exposed to silica and asbestos on the job.
Mm-hmm.
And then the other study was the study of workers in the nuclear weapons
This is
plants
Oak Ridge?
in Oak Ridge. And that topic ended up being a real important determinant of my future.
Mm-hmm. I remember that you then did a series of studies